Hey everybody, it's Dr. Dave, Psychiatry. Thanks for being here today. Thanks for coming to the YouTube channel. If you haven't done so already, please subscribe and like. That helps through the algorithm for Google, helps other people get the information that they might need to feel better because it gets it to the top of the search engine. Today, somebody might say, I had a panic attack and they said there's nothing wrong with me. So they Google search panic attacks and they get layers and layers and layers of official stuff that doesn't help them. So I'm going to talk about this experience of what happens when you have a panic attack and you go to the emergency room and they say there's nothing wrong with you. First of all, panic disorder is a really scary thing. And people ask me when I ask them, do they have any panic symptoms? Sometimes they say, what do you mean by panic? Well, a panic doesn't mean that you had somebody point a gun at you and you were scared. Panic and fear are two totally different things. Panic comes out of the blue. In fact, what I tell people is that if you feel like somebody just pointed a gun at you, or you just had a near-miss car accident and you didn't, if you're just minding your own business and you don't have any stimulus to cause that, well, then that's what a panic attack is. And sometimes that's associated with getting scared that you might have a panic attack in public, and so you stop going out, you become more isolated. And when you're refusing to go out, or you're fearful of going out, or fearful of being in a building or in your workplace, that's called agoraphobia, which literally is Greek for fear of the marketplace. So panic disorder and agoraphobia with panic are two things that I deal with as a psychiatrist, as a brain chemistry guy. I deal with these every day. And most times it sounds like this. Patient comes to my office and says, yeah, I had to go to the emergency room. I felt awful. They did a bunch of tests and they told me nothing's wrong. Now, if you felt so bad that you called 911, you were transported by ambulance to an emergency room, you're in the emergency room for 4 to 6 hours, you had all sorts of medical tests, and it might cost you nothing, or it might have cost you a couple $1,000s just to have that whole thing happen, and someone tells you there's nothing wrong with you, well, there's something wrong. Really what they're saying, when the emergency room doctor gives you a couple of milligrams of Ativan to tide you over for a couple of days. We'll talk about that medicine in a second. And says there's nothing wrong with you. Really what they're saying is they've done an EKG. You're not having a heart attack. In the emergency room, they're mostly worried about, do I have to send this guy for heart surgery, send him to a cardiologist? And when an emergency room doctor or nurse says, no, we didn't find anything wrong, really what they're saying is they didn't find anything wrong that they're going to treat right now. And so they're going to give you a little bit of medicine, and we'll talk about the medicine here in a moment. But the experience of having a panic attack is really, really frightening. And for people that have panic disorder, and there are probably 1 million people in America that have panic disorder right now, it's an extremely scary thing to go through. And so we're going to talk about panic attack and what causes that today, and the fact that there is something very wrong medically, fortunately very treatable. So I'm going to grab the trusty white sheet of paper and my Sharpie, and as you know, I'm going to draw what we call the normal range, 2 lines, a line that says high and a line that says low. And obviously this is where I want your brain chemicals to be, and today we're going to be talking about low GABA, GABA. Stands for gamma aminobutyric acid. Now, I typically don't, I say that once to patients, but after that, I just like them to know about GABA. And I'm talking about GABA shortage below the low line. So not excess, talking about not having enough GABA activity. There's another reason to know about the word GABA. Unfortunately, there are now what are called health food stores, and sometimes online, you can buy GABA and put it in your mouth and eat it. The problem with that is you can't get the GABA into your brain where you need it. And so when you do that, you're typically wasting your 30 or 40 bucks. So I like people to know about GABA principally because I don't like them buying GABA and eating GABA pills because it doesn't do anything to treat their GABA. When we're treating low GABA, we treat patients with medicines that are called benzodiazepines. And we'll talk more in probably a separate video about benzodiazepines and why people are fearful of benzodiazepines, which in some ways they should be, in other ways they should not be at all. So appropriate respect for benzodiazepines is what we want. But if you have a GABA shortage, then in my method of brain chemistry troubleshooting, you're going to need a GABA booster. Now, the one that I referenced before, because it's very common in emergency rooms, is Ativan, which the generic is lorazepam, Xanax, which the generic is alprazolam, and Valium, which the generic is diazepam. Those are three very common GABA boosters. So I'm just going to say, for this example, the emergency room gave the patient a milligram of Ativan and said, there's nothing wrong with you, you can go home now. So the patient goes home and says, there's still something wrong. And fortunately, when they're in my office, that means somebody knew about me, or they had heard of me, or they had a family member that told them about me, or a friend. So we were able to do a good trial of a medicine for GABA boosting. And most times when there's that story, that fixes that. I'm just going to put a pause for a second on the treatment, though, of the GABA and talk about something that is arguably more important than any of these medicines that are GABA boosters, the GABA boosters. And that's what I call the CBP. CBP stands for Controlled Breathing Protocol. So if you've ever had a panic attack, or you are coaching someone who has had panic attacks, I need you to learn this, and I need you to lock it down. If you have ever said, or other people have said to you, hey, take some deep breaths, that is the wrong thing to say. Deep breaths and excessive deep breathing causes panic attacks to be worse. So one of the most important things I teach people in my office outside of about the medicine is what I call the controlled breathing protocol. And controlled breathing basically means hold your breath. If you heard the old technique of breathe in a paper bag, yeah, you can do that. But here's what happens when you start taking deep breaths. And someone coached you to, hey, take full deep breaths. Well, here's what happens. You have a critical molecule in your brain called carbon dioxide. Carbon dioxide is required for all of your brain chemistry systems, all of your body chemistry systems to function properly. And so a certain level of carbon dioxide is normal. If you have too much carbon dioxide, that can be bad. But if you have too little carbon dioxide, that's what we're talking about in this scenario. So this is how you make yourself have low carbon dioxide. I'm going to do my hands on my breathing at the same time. You start breathing like this. Hey, take some deep breaths. Okay, I'm starting to get a little lightheaded on myself. My carbon dioxide's low now. I can feel my ears ringing a little bit. My head's a little zingy. My face feels a little tingly. My lips feel a little bit numb. If you keep doing this, you will go beyond what I feel now, which is a little bit of low carbon dioxide. You'll get way down here. And if you get way down here, your hands draw up, your fingers draw up, your face gets flushed, you can't think straight, and the next step is you pass out. You know what happens when you pass out? Your breathing looks like this. Now, I'm fixing my low carbon dioxide by just breathing that way. But your body fixes it naturally when you pass out. What I need to teach you is how to stop it before you pass out, because you don't want to call the 911. You don't want to get an ambulance. You don't want to spend a couple $1,000s in an emergency room and waste your day having somebody tell you that there's nothing wrong with you. Here's what you do. You look at your watch or your cell phone and you breathe once every 15 seconds for 2 minutes. That's 8 cycles of controlled breathing, 4 times a minute for 2 minutes. That fixes it. And here's what it looks like. I won't do the whole 15 seconds, but maybe I will the first one. You can see that I'm not I'm getting plenty of oxygen. Shortage of oxygen is not the problem. You can breathe every 4 minutes, every 15 seconds, sorry. You can breathe every 15 seconds and not have any problem whatsoever. And as you do that, you stop exhaling that carbon dioxide. Every time you exhale, you're breathing out that carbon dioxide from your body. If you hold your breath, you're keeping it in, and that level is going from here to here. Sometimes I have patients that say they sit in my office the first time I meet them, and they are so anxious that they say, I can't do that, doc. I can't hold my breath. You know what I say to them? You have to. Because if you don't, I'm going to call the ambulance for you. And so sometimes it's a struggle, but if I say, okay, just breathe with me, just stop this hyperventilating stuff, stop this overbreathing stuff, and just breathe with me. Ready, go. And I make them do it on the clock. And if I can get them to do it for a minute, then in the second minute it's easier. And after the second minute, after 8 cycles of 15 seconds, if I get them to do 2 minutes of that, that fixes the carbon dioxide problem. Now, that doesn't fix their GABA problem, which we're going to talk just one more little second here about, but it certainly prevents them from getting worse in terms of having to have medical attention and ending up in a medical emergency room. So if you witness somebody doing this, just do me a favor. Don't tell them to take some deep breaths. Tell them to control their breathing. And tell them to, and if you have to, make them breathe every 15 seconds. That's a controlled breathing protocol. The reason I call it a protocol, it's not just as simple as, hey, don't breathe so much. It's literally 2 minutes every 15 seconds. That's 8 cycles of controlled breathing. You do that, and you'll take your carbon dioxide from here to here. If you don't believe me, try it. Now, back to GABA. A lot of people don't like the words like Ativan and Xanax and Valium. A lot of people don't like the medicines that we use for treating GABA shortage. But I'll just tell you something. Whether or not you like them doesn't matter. If you have a GABA shortage, you have to take a medicine that's going to boost GABA. And so we're going to do another whole video at some point about panic disorder and all the different approaches to panic disorder. But the main thing today is that if you find yourself in a situation where somebody said, hey, take some deep breaths, and that ended up being a near disaster, or if you've already had the experience of a panic attack and you needed to be told that you weren't crazy, you're not crazy. You got a medical problem. You have a GABA shortage. And the second thing is, whoever said there's nothing wrong with you was wrong. There was something wrong with you. You breathed yourself into a low carbon dioxide state, and that's why you felt sick. So fortunately, they told you didn't have a heart attack. That's a good thing. Doesn't mean that you don't have something to pay attention to, but it's good to know you didn't have a heart attack, right? Anyhow, that's all for today on controlled breathing protocol. I hope this was helpful. Be sure and tell your family, friends, anyone who needs this about the YouTube channel. And thanks for coming to see me today.